someone coming in arguing or.
Yeah, that happens. I'm talking about. We always see. Well, I call them Karens and Kyles because Kyles are the guys, Karens are the girls, obviously.
Kyles.
But yeah, we see both. We mainly see a lot of Karens.
We usually just call them Sally and Chapa.
This food.
Stupid. No.
That guy's being such a Chapa.
There was one.
Or Sally.
Shut up! You talk so fucking much, bro.
All right, guys. Welcome back to another Country Guys podcast. With us today, we got a special guest. We got Lisette. He's a dentist.
I'm a dental assistant.
Dental assistant. Same thing. Same thing. It's a dentist.
You both yank out teeth.
You put your hand in other people's mouths.
Okay.
We got
without washing them.
we got Andy.
So guys,
we got Isaac.
Yeah, what's up, guys?
All right, guys. For today's topic, we're gonna be interviewing a dentist assistant. You know, whatever you guys want to call him.
There's a big difference. Just letting you know.
What's the difference?
What's the difference? The dentist and a
so
dentist assistant.
A dentist actually does all the procedures. Like they do the extractions, they do the numbing, they do the fillings, the root canals, everything.
All right, let me tell you how you numb someone.
No.
You knock them out. Bah!
And then the assistants, we're just there to basically give them all the instruments that they need, all the equipment.
Make sure that they get the hammer, the pliers, the chicken wire.
Put the air conditioning down, Isaac.
Okay.
The speed or what?
Yeah, the lowest setting.
But we basically
go.
are there like.
Feels so much better in here with that.
For real.
It does.
It does.
Because before we'd already be sweating.
Fucking hot as shit. Fuck yeah.
Oh yeah, but like I was saying before, anyways. But
What were you saying?
The assistants, we basically like are there to if the patient like some patients have a lot of saliva in their mouth. We basically have to like get all of the saliva, making sure everything.
I got you, Poppy.
You go in there with the straw?
No.
Oh, that's
That's
disgusting.
disgusting. No, but we basically have to keep the field like where in the mouth completely dry for the doctor to work.
What do you guys do at your guys' work? Like, you guys just specialize in pulling out teeth?
Fuck
or
around, you stupid.
fucking getting high off your guys' gas, you know, just...
Okay, so we don't do the gas, like the laughing gas or anything. We basically just numb the patients just right then and there with a needle and.
You don't sleep a patient?
No, we just numb the area that we're working in.
with the needle?
Yeah.
Oh, okay.
And then
old-fashioned way.
Like the needles you use for heroin?
I don't think that's old-fashioned way, Pantera. Motherfucker, I don't think they.
Yeah, I think old-fashioned way they didn't use any type of
shit.
All right, I'm gonna yank out these three, so they go
count
with
of
the
three,
pliers.
one.
Yeet!
Pull that motherfucker out. Probably, yeah.
No, but
They're using vice grips and it slips off. Oh crap! They go back in there, bleeding.
Hold on, man. Let me go back one more. I didn't get a good pull, boy,
I
man.
didn't get a good grip. Yeah.
Shit.
Well, whenever you're doing anesthesia, you're basically, what, an anesthesiologist then?
no, we don't do like that. That's the dentist or the hygienist. So assistants, we set everything up for the doctors. So we set up the whole room. We make sure everything that they need, like all the instruments are there, the hand pieces, the burrs. Like say for instance, we're doing fillings. We do the filling, like make sure that's all there. My office, like we do.
Oh, yeah, I know what a filling is.
Okay, so you don't know what a filling is? So when you have
fill it in.
No, we
Just
have
fill
we have a normal like a small cavity or like not as big cavity. We'll clean that out and we'll just basically put composite filling over it. So like when you go like for a normal checkup.
So basically, what he said, he just dumbed it down.
You
Fill
it.
the hole.
Fill that bitch in.
Yeah, I guess. Okay, to dumb it down. Yeah, we basically just fill it.
You gotta dumb it down.
Okay.
We're a little slow here.
Okay. Sorry.
Well, where you guys are, numbing somebody, giving it the needle.
The good old 1-2.
Has anybody ever chewed on it while they were getting numb, like on accident? Like they have the needle in their back of their mouth.
Tell them the story when you
it.
poked yourself.
Oh yeah, I
Accidentally poked herself.
I didn't know.
I'm trying to feel shit. I'm not trying to feel shit. I accidentally poked myself.
No, okay, because at my office we get really busy. Like I'm talking about, we see at least more than 80 to 90 patients a day. That's a lot.
That's a lot of mouths, dude.
That's a lot of mouths.
And so
Shoot.
when we're
That's a lot of
cleaning up,
dicks. Think about it. It's a lot of dicks, dude.
so basically when I was cleaning up the room, we have to take apart the syringe which holds the needle, and when I was taking it off, you have to twist it, and normally when you twist it, you bend it and pull it out. So
I thought they just retract back inside the needle.
no.
No, that's a lie.
That's only
No,
like that,
you're
thinking about like the doctor's office.
Yeah.
Oh, it's not the same thing.
No.
Oh,
So
well, I guess not, guys.
because the ones at the doctor's office, those are all disposable. So it's one time use and you throw it away. Like ours, the needle, we dispose of it, and the lidocaine, we dispose of it, but the actual syringe, we keep.
You guys reuse a syringe.
The syringe doesn't
The syringe doesn't.
it doesn't
poke
have
you.
anything.
I know, motherfucker. But don't you guys like pull in the blood and then push it back
No.
in?
No,
No.
that's they just inject.
Pantera, what are you talking about, dog?
That's what.
She
Ju-
keeps the tube.
Yes,
They reuse the
but
Not
they
the
don't.
okay.
They don't
You're
pull
thinking-
anything
Let's say a
out.
motherfucker with some nasty ass breath, nasty ass mouth.
He's,
Oh my
She
he's-
uses it, puts it. Let's say the syringe goes in my mouth. After that, it goes in your mouth. You know how
No.
disgusting that shit is.
I'm pretty sure they have hella fucking
They
syringes,
clean
Pantera.
and they
clean
clean
them.
it.
And I'm talking to
And
How
it's
you
not
know they
like-
clean it right?
It's not like the syringe is pulling blood out or anything like that. You just inject. It's like this,
Yeah.
okay? It's like this. I'll fill up this water bottle. All right, and you open up your mouth. I'll fill it up again. Patera. And it's not pulling anything out.
That's like a really bad example, but okay.
But I'm at a distance, okay? I'm like this. 'cause
No,
the
mom.
needle-
It's like,
the needle
Isaac,
is-
how long do you think the needle is, Isaac?
I don't know, probably.
It's not okay. You guys are like really over exaggerating.
But that's what I'm saying. It's not like.
I think you're
You-
thinking
you-
of the
I
actual.
think you get what I'm
You're
saying.
thinking of the
Okay,
actual
thank you.
lidocaine, which is the little like. Well, obviously.
The actual syringe, like an actual
The
shot.
actual thing that numbs you.
Show a picture right here so I can see. Oh yeah.
Okay.
Oh, okay.
Looks
I know
like
you-
that, guys. Looks
yeah,
like
okay.
that.
I know what you're
So-
talking about.
So the syringe, it doesn't have anything, and we make sure we clean everything and we sterilize it before giving it to another, using it for another patient.
All right.
And we have multiple ones, so they're not all going to the next patient after that.
So bottom line, you were in a hurry. You poked yourself.
Yeah. Okay. Bottom line, I was taking it apart. The lid came off because I didn't unscrew it all the way because I was getting called. I didn't unscrew it all the way. The lid came off, and when I went back because I was going so fast, it went right into my finger, and my finger would go numb for a week or
That's
so.
disgusting.
Your shit went on for a week.
But it was a clean.
Did you-
It was a
but
clean
they-
needle.
Oh,
We
it
didn't
was
know.
I thought you put in someone's mouth then it stabbed
Oh
you.
no! It was a clean.
I was about to
needle.
say,
It was a
bruh.
clean- It was
And
a
then
clean needle.
and then you had to go to the doctor, right?
Yeah, I had to go to
Because
the
you have to
doctor.
report stuff like
Yeah,
that.
but the thing that
Oh,
sucks
you do?
is
Yeah.
that
Oh, I didn't know that.
Tech-
You know,
Technically-
even at work over there where I'm at, even if it's a small cut, you're supposed to report it, but no one does. But typically, if you get hurt, you're supposed to tell them.
Oh.
And technically,
Damn.
when I went to the doctor's office, they were supposed to test me in case I had anything. Even if it is a clean needle, they're supposed to test you. I didn't get tested or anything. They're just like, well, we can't really do anything.
Yeah,
since it's
I get the
lidocaine."
fuck out. We got
So-
bit. We
Wait,
got
what'd they tell you?
They're like, we can't really, because I told them, I was like, it goes numb. Like when I'm working with the doctor, my finger goes numb. And
Ah, shit. Trying to pick that shit up. Ah,
Hey.
shit.
Hey, that happens to a lot of guys at night. It just goes numb. You're like, fun's over. They might have got an injection. I think I got an
Does
injection.
that happen to you?
Probably.
Yeah, you need to check that
I
out.
need to check checked out. And then
But,
Get checked
yeah,
out, Junior.
and the doctor
I
was
don't
just
think
like,
They
that's
might
healthy.
have stabbed you with the needle.
yeah.
but the doctor was just like, well, we can't do anything because you still have lidocaine in your finger. So come back in a couple of days and we'll check it out. I went back and they're like, well, it's still going numb. And I'm like, yeah. And they're like, okay, well, it could be like you punctured something. So if that happens in like a couple of weeks, we're going to call you, check up on you. If everything looks good, you don't have to worry about it. We'll close your case. But if it still goes numb, we're going to have to reopen it and like actually do tests. And then when I told my boss, he was like, they were supposed to test you. They didn't test you? And I'm like, no. And he was like, so they just said.
No, bitch. Nothing. Text me. Text
They're
me.
like, they just looked at you. And I'm like, yeah, they looked at my finger. They're like, okay, we can't do anything. So bye. That's basically what they did.
When I got hurt at work, they drug tested me. They I think that was it. Just drug test me to make sure that I wasn't like. Oh, and an alcohol test. That's what it was.
Good to know, Isaac.
Well, I guess that. No, yeah, they're supposed to test
Nah,
you.
I get you, dude.
They're supposed to test you because, like, let's say you get hurt, right?
Yeah.
Let's say for whatever reason,
Like,
an
so the
actual-
company
an
won't be
actual-
liable.
Yeah, because if you're on drugs or you're high or whatever, or you're drunk and
So that's
you're
why
doing
kids,
breaks and a spring
you
comes out and
do
hits you in
drugs
the eye.
before work. And
I
then
don't
when
think
they,
that's how it works, Pantera.
Yeah, I don't think that's how it works.
Shit. What's the most disgusting thing that you've seen working as an assistant
Oh, my
dentist,
God.
as a
Show
dentist?
them the pictures.
Okay.
We'll put some pictures up. Hopefully, YouTube don't take it down. I don't know. I
No,
doubt
these
it.
are learning.
Yeah, this is for learning.
This is an
YouTube
educational video.
Educational video. Exactly.
I'll let you guys see it, and you guys could tell me what you guys think it is.
Don't say what it is yet.
I'll tell you guys.
I think
like-
you already saw it, right?
Yeah, he's seen it. Andy needs to see it.
Andy needs to see it. We already know what it is.
Disgusting. It looks like an ear. It looks like a.
Can I see, bitch?
Here,
Fuck, you already seen it.
fuck you.
What's that? Why does it have hair?
Looks disgusting, huh?
What is that supposed to be exactly? Like what the
I'll tell you guys- I'll
where
tell
the
you
fuck where in the hell is that shit? Is that a tongue?
Bro, that is disgusting. Looks like a potato chip stuck in there,
Potato chip.
or like a.
Okay.
Wait, all right,
A hairy
explain
potato-
it.
Okay, so this patient came in, and I guess she had said that we had asked her like what, like obviously we had to ask her like, why
Like,
you
yo,
came
bitch, what
in.
the fuck is that?
No.
What
No.
the fuck? Yeah, we can't help you with that shit.
No, so we basically every patient that comes in, we have to ask them like what's the reason when they came in, and she was like, oh well, I'm having pain. Like obviously you've seen that she has no teeth right there, and that's on her lower left side.
Oh, that's no.
That's her gums.
Let me talk. She has no gum right there. So basically what happened was she had a tumor, and they had to take all her lower teeth on the left side out, and they took part of her jaw out, and they had to put basically do a reconstruction on her jaw. And the reason why there's hair on it is because they took a piece of her leg and put it, like the skin, and put it in her
Ew.
mouth.
What?
Yeah,
That's fucking disgusting.
it's crazy.
Well, how come they didn't like?
Shave it.
Yeah.
That's what I said. I don't know. I didn't want to ask the patient because I was like, oh, I'm not gonna.
But
say
that's what it
anything.
went in. That's what they went in for.
Yeah, because I had asked the patient. I was just like,
That's one hairy ass.
Did I
bitch.
see-
Put your head a little up or turn it around.
That's all I can go for. My forehead's just so fucking big, Junior.
It's so people can see your reactions. It's because people. look
Motherfucker,
at
they can't see me. I
reactions.
see the videos every time, bro. This is the only shit they see.
Anytime you react, look at the camera.
Oh my god.
So act
oh my
surprised.
God.
So
Fucking
stupid. Act scared.
What part of the leg was it though? Did she tell you?
No, she didn't say. I didn't ask her like deep into it, but
Oh,
I had.
dude, I've
'cause-
been. I've been
'cause normally
investigation, bro. This is all fucking.
She was a new patient, so with new patients, we basically had to take photos of their teeth in case they have any cavities. And I had seen it, and I'm like,
That's disgusting.
what's that in your mouth? And she was just like, oh, I had surgery, and they had to take a flap of my leg, like my skin, and put it in my mouth. And I'm like, so that's like a piece of your leg basically in your mouth? She's like, yeah. She's like, I had the surgery over like
Like your dad, huh?
like 5
Yeah.
years ago or
Well,
3
my
years
dad's
ago.
worse.
Your dad had a piece of his ass right here.
Yeah.
I guess that,
For real.
that came out
Ass,
wrong.
arm,
like-
ass.
like-
No, but he has a
Yeah.
piece of his ass right
He's
here.
probably like from here all the way over here. He has a whole big ass piece of ass right there. The cool thing is that you pinch it, he can't feel it. It's all dead right
So you
there.
touch ass. You touch my dad's ass.
practically
Basically.
fool.
Damn, that's kind of weird. Can you imagine, dude? You're the boyfriend kissing the girl, right? And you're just, you're making out.
You feel the hair?
What the fuck?
Well, I'm pretty sure the
Yeah.
guy knew what the fuck was up though, dude. You know what I mean?
Yeah.
Hey,
I'm
no, bro.
pretty
Some
sure.
girls don't tell the guys until like it's like.
No, I'm pretty sure
So
you're
they're
able
like
to
30
fuck-
years deep, huh? With
You're-
like 5 kids.
I'm pretty sure you're able to see a
Yeah.
fucking girl if she had no teeth down here, dog. You know what I'm
No,
saying?
you can't really because it's like covered by the cheek.
They're probably a smoker, right?
No, they're not.
Oh, they're not.
Because
Did she
she
tell you
also-
why she had the tumor?
Because- No, but she also had she actually had a brain tumor as well. Like
That's crazy.
she had brain
Bro,
surgery.
poor lady, bro. She got bad
and
luck,
she
bro.
had jaw surgery. Yeah, it
That's
was
bad
crazy.
luck.
That's crazy.
I felt bad for her,
bro.
and it was all like within like 3 years ago. I want to say 3 to 5 years ago. I want to say.
That sucks. Can you imagine having to do like a whole reconstruction of your jaw? You have to like relearn how to eat. You get what I'm saying? Like you have to build those muscles back up.
Just shoot it up your ass, and you don't gotta eat.
No, you like wow. fool.
Shoot the other way. This is where you shit.
That's disgusting, Isaac. What the fuck do you
Stupid.
watch?
What the hell's your problem?
Human centipede.
Don't watch that, guys.
Hey,
That's
I watched that
disgusting.
shit.
Rated R.
That's crazy as fuck. Or have you watched that one with the one that they turned the guy into a sea? What is it, seal?
A sea otter? No.
Seal.
An elephant seal.
What the fuck is an elephant seal?
It's an elephant seal.
That's
He hasn't watched it. Anyways, what's the
You know what an elephant seal, bro, is? Me neither, fool.
do those
First time I
masks
heard of
help
that
you
answer.
mask people's breath?
No, they do not.
What's your purpose of wearing a mask? What's the main purpose?
So basically,
To
what,
stop COVID?
no,
It was like, so you want, I don't know.
because even like people at our office, like we've gotten COVID, even with the mask, even with, because we have to be all protected. So we have like shields we have to wear, we have goggles, we have
So
to wear
y'all full on hazardous
But-
fucking suits.
Y'all
and shit.
motherfucker
we
like
still-
Monsters Inc. type
that,
shit,
like
huh?
the Wilder's mask, but it's
And
a
it-
Even then, like there's people at our office, like at my office, that got COVID.
Damn.
Even like when we're fully protected. Like,
But how do you know? How do they know it's COVID? How do they know it's not just a basic cold?
Because we go to get tested.
Do you-
That's bullshit.
we're-
I don't
When we
believe that.
when we get sick, my boss basically sends us to go get tested.
Do you guys just, hey, here's some hand sanitizer, and you guys just open your mouth.
brush your cheeks with the hand sanitizer.
No, actually, so we basically now for like COVID, ever since we started opening up again, we have to give the patients Listerine, and we have them rinse their
Makes
mouth.
sense.
But even with the Listerine, some patients, their breath reeks. Like I'm talking about, we gave this guy like at least have like it was a small cup. We
Gotta
gave
give
him,
him the whole
like, half.
fucking thing. Chug this
Hey,
shit,
chug
motherfucker.
that shit.
Because
Don't
when
just
you-
wash the shit.
When he
Chug that
came in,
motherfucker.
when he came into the office, he smelled like straight marijuana.
Shit.
And
And marijuana.
so
You thought you were at a Snoop Dogg concert or
apparently, but when he came in, it like reeked so bad. Like I'm talking about, he had to get, I want to say, it was a root canal, and
Ugh.
basically I was assisting the doctor, and I was like breathing out of my mouth. I couldn't breathe. Like I was telling the doctor, I was like, doctor, like I can't. I'm about to pass out.
Yeah, güey, yeah.
Stop breathing, bitch.
Like I couldn't, and so my boss was like, "Hey, Maleni, switch with Lizette," because I looked like I was about to get like throw up, and like when I
Ugh.
left, like even my coworker was just like, "Dude, like I wasn't even in the room and I smelled it," and I'm like, "Yeah, like that shit stinks,
How the
dude."
fuck does that work?
Tell him the
No,
one.
like
Tu
because
perro más si huele, güey, but I haven't been in the room.
no, like okay, so our operatories they're open, so it's not like a closed off room. So like
Oh, okay. Oh, they're open. They're halfway open. They're just like a whole like
it's just
wall,
like
wall,
it's just like a wall.
chair, wall, chair, wall, chair.
Yeah, basically.
Oh, okay.
There's probably like one room that's actually
That's
closed off,
disgusting,
but the rest of
bro.
them are open. So like if you step like not even like 5 feet away, you're able to see and like hear everything that's going on.
Whenever you're eating, or whenever you really first started off, you know,
Okay.
one of your stories, you're looking at food, you know, mashed potatoes or something. Do you ever just imagine like,
Damn, I gotta clean my teeth after this.
no, like you just imagine a patient's mouth and like their skin or blood, and you're just like, I'm fucking done with this shit.
I don't think that's how it works. sometimes.
Personally, me no. I actually have a hard stomach. I think
Fuck the
I find it entertaining, especially when doing extractions, because a lot of stuff happens.
Because
in
you see
extractions.
stuff hitting between teeth. huh?
Entertaining.
Like
oh, a
Like,
gold
wow,
nugget.
That was
No.
that was a piece of meat I ate 10 years ago.
no,
Oh, let me get that
you
for
don't
you.
see. You don't see like
God
What
damn.
the fuck?
Good
You don't-
teriyaki
Yeah,
chicken.
you guys cook this thing good.
you guys don't see like
Is
food
it
or
smoked?
anything. Like
Yeah.
I'm talking about like during extractions, I find them like kind of cool because basically like if it
Because you're hurting the motherfucker. That's why you guys find
they
it cool,
don't
huh?
feel anything though. That's the thing.
I'll
like,
slap the bitch. You feel this shit?
no, like the story that he was saying. So there was one time when I was barely new. Like it was, I want to say like my 3rd week, like actually being at the office, and my boss was like, "Hey Lizette, come help me with this extraction in room 5." And I'm like, "Okay." And the patient, like the tooth was already broken, so it was only like the actual root that's in the like the gum area. So what we had to do is we had to drill like with the handpiece around the gums to cut it off because it was basically covering that tooth. And when he went in, he was trying to get it, but it was stuck. And so my boss, like with the forceps, he basically had to like go like in and rip like the gum area. So like there was like gum that was like flappy. And like afterwards when we had like that was right before lunch, and like I was just like, oh dang, like I had flinched about it. And my boss was like, "What is that? You can't have no little extra meat flavor."
What the?
That's disgusting.
I was
That's
like,
nasty.
"Oh hell no!" Like I had went to lunch right after that, and I'm like, at first I was just like, "Oh dang, like how am I gonna eat?" But then I'm like, "Wait, why am I gonna let that get to me? Like I'm gonna forget about it either way." It's
Esas
like-
pinches tacos, chale, que chingue su madre.
But yeah, that's
Oh,
that's
bro.
what he was talking about.
I can't do that. That's
You,
disgusting.
you guys get more girl patients or guy patients? Or you guys get kids, anything?
Yeah, we get like all types. We
Anything.
get like to the point where our
You get
oldest
newborns.
are no.
No mames.
No mames, I
No
did.
mames, buddy. They don't even have teeth, boy.
You guys have to give like birth to some patients. What's the craziest thing you guys
Are
ever
you
that's
dumb
ever
or are
happened?
you just?
I was just-
Hey, he
I was just being
autistic. He rides a
stupid.
short bus.
I was just being
He just
stupid.
keeps
Alright.
the short bus.
How am I related to him? That's all right.
Okay, never mind.
All right, guys.
I'm
We're
related
sorry
to
about
that.
that. We'll be back.
I'm
Cut that
related-
shit.
Go
I'm
whoop his
related
ass.
to that.
Like I just said, what's the craziest shit you've seen?
Like someone coming in arguing or
Oh yeah, that happens. I'm talking about. We always see. Well, I call them Karens and Kyles because Kyles are the guys, Karens are the girls, obviously.
Kyles.
But yeah, we see both. We mainly see a lot of Karens.
we usually just call them Sally and Chapa.
This food.
Stupid. No,
Oh, that guy being such a Chapa.
there
you
was
know?
one.
Or Sally.
Shut up! You talk so fucking much, bro.
Sorry.
Should I just like stop talking? You can go ahead and talk.
Take
Go
over,
ahead.
Isaac. Take
Take
over.
over.
Shut the fuck
Let me
up.
take over. Let me
Okay.
tell you what she does at work, all
Okay,
right?
go ahead.
I'm just kidding. Go ahead.
Okay, with arguing, there was actually a patient. She was okay. We see black people, we see whites, we see
Yeah.
you guys see every.
we see everybody.
Everybody.
And
Doggy.
like I'm not trying to be racist or anything, but she was black, and she comes in and she was like, she was yelling at our receptionist, and she's like, I want to talk to your fucking doctor right now, and like your boss, your manager, everyone. And then they're like, okay, well go ahead and have a seat, and we'll like obviously we're like really busy, we'll get to you. So she was just like mad, and my boss walks up there, and she was like, she's seen him, but when he was walking to the back, that's when she had walked in, but she wasn't even supposed to, and she was like in one of the rooms, and that's when they were like, we had actually called her, and she was gonna be the next patient, and they're like, go ahead and have a seat, and she wanted to talk to the doctor right away, but we didn't let that happen. So we sit her down, and we're like, okay, what's like going on, blah blah blah, and she's like, I'm having pain, like all this other stuff. Like I went to my doctors, and they took X-rays, and they're saying that I have metal in my mouth or something like that.
What the fuck?
And I guess it was something that had like to do with like a root canal or something. And I guess a piece of the file got broken in there. And she was saying that it was causing her like a lot of pain. And normally when that happens, like, cause it happens a lot. It happens a lot in dentistry.
Accidents happen.
Shit happens.
Where
yeah.
the file breaks.
That's what I'm saying.
Inside the patient's like mouth, like not in their. It's not actually in their mouth. It's basically
Shut
in
up,
the
fool.
tooth itself. So
Okay.
when